Hi, Dr. Shook here. In this video, what I want to talk about are some of the common problems with allopathic or traditional medical approach to thyroid disorders. With the typical patient that has a thyroid condition, you go to your primary physician, your primary care physician, and they will, if you tell them that you have symptoms of fatigue, your hair's falling out, you have brain fog all the time, one of the things that they're going to do is they're going to order a thyroid marker or panel. Typically what you get in this panel is one marker and one marker only, and that is TSH, which is thyroid stimulating hormone. That hormone is actually not a thyroid marker at all. It is an indirect measurement of your thyroid function. And what that is, the TSH is a hormone that's made by your pituitary gland. If you go right here behind your eyes, between your eyes, straight back, there's a small gland that looks like it has a little stalk and a little bulb on the end of it. It's called your pituitary gland. The pituitary gland makes thyroid stimulating hormone. The thyroid stimulating hormone signals your thyroid to ramp up its production of enzymes and to manufacture T4 and T3, which are your thyroid hormones. That is the only thing that's typically measured. And if that number is high, then your doctor will reason that the gland is trying to signal your thyroid to make more hormone, so you must be low in thyroid hormone. If that number is very, very low, then your doctor reasons that, well, the pituitary is not telling your thyroid to make more hormone, so you must have normal, or if it's really low, then you must have hyper or too much production of thyroid hormone. So in a lot of cases, most of the time that number is that number's higher, and which indicates or signals that your thyroid production is probably low. Okay, so what they do in that case is they'll prescribe you a thyroid replacement hormone and say, okay, take this and let me know how you do. And a lot of people, what ends up happening is they don't feel any better, or they might feel better for a short period of time and then they feel worse. And then there's another scenario where patients go in and everything looks good and they say, well, you know what, I think you're fine, everything's fine here, take an antidepressant. And that is a very common scenario. And the problem with this is that there's no appreciation for why the person feels the way they do. There's absolutely no further investigation. And here's the thing, it's not that your doctor doesn't mean well, because they do mean well, but that's how they're trained. So that's what their training is, and that's how it works. And I mean, it can be a very frustrating system to be put into. But thank God we have our primary care physicians, because they do so much for us. But with a lot of chronic and inflammatory diseases, and it's not a great system at this point in time. And a lot of your primary care physicians, they'll tell you that. I mean, there are some shortcomings, and this just happens to be one that's a very, very big one. And so here's a scenario. With this type of problem, what really needs to be done is they really need to be ordering a more expanded thyroid panel. But here's the issue. They're not going to do that because they don't really know how to use a lot of those different numbers. And what they'll do is, instead of doing that, they'll refer you to the endocrinologist. And a lot of times the endocrinologist will order a more expanded panel, and with an endocrinologist, you're more likely to get tested for Hashimoto's or for Graves' disease, which are both autoimmune conditions to the thyroid, which 90% of low thyroid is an autoimmune condition called Hashimoto's thyroiditis, or Hashimoto's thyroid. And the reason for that is because it is a very common autoimmune condition. And a lot of patients think that they have a primary thyroid problem, or your physicians think that you have a primary thyroid problem, when in reality, the reason that you feel bad and the reason that your TSH and your markers are off, or that your TSH and markers are normal but you feel bad, is because you actually have a primary autoimmune condition called Hashimoto's disease. And the real problem with this is that the medical community is not finding it, and if they find it, unfortunately, the addressing what drives or causes an autoimmune condition is not being done. And what is done is that typically you're placed on a steroid or some type of immune suppressing drug, or you are there are a lot of other more invasive and more radical procedures, which sometimes are necessary. But these steroids and a lot of times these anti-inflammatories or these immune suppressing drugs, they do nothing to identify why you have an autoimmune condition, and they do nothing for your symptomatology except to stop the thyroid tissue destruction by your immune system. So what I want to do was just touch on the major problems in the diagnosis and workup of primary or of thyroid disorders within our primary care medical system, our allopathic medicine. And if you have any questions, let me know. I'm Dr. Shook. I appreciate you taking time from your day to learn more about your health. If you need anything or have any questions, just let us know. Thank you.